Welcome to week 15. Your baby is now the size of a tomato. This week, your baby is practicing his facial expressions: frowning, grimacing, squinting, and wincing. His hands are also making little fists, and he can even grasp them together. Your baby can also hear now. Between your heartbeat and the blood coursing through the umbilical cord, it's actually pretty noisy in your uterus. Your baby can hear your voice too, and it's important to him. By the time he's born, he'll remember it. Studies have shown that newborns prefer their mom's voices to those of others. As for you, you're probably feeling pretty good. And if you're lucky, you may even have that pregnancy glow, which is caused by a combination of increased blood flow, hello rosy cheeks, and oil production in your skin. You'll also probably find that your nails are growing faster and stronger, and that your hair is thicker as well. If you're not feeling the glow, though, you're not alone. Pregnancy doesn't agree with everyone. A surprising symptom you may be experiencing is depression. Most people are familiar with postpartum depression after the first few months of caring for your baby, but it's also fairly common for depression to develop during pregnancy. Up to 23% of women struggle with prenatal depression symptoms, including difficulty concentrating and sadness or anxiety that impacts your ability to work, socialize, or parent your older children. If you're worried, talk to your midwife or doctor. Possible treatments include support groups, cognitive behavioral therapy, and certain antidepressants. Between now and week 20 of your pregnancy, you'll have the option of doing more tests to screen for neural tube defects. You'll either have a quad screen or integrated biochemistry. The results will tell you the likelihood of your baby having neural tube defects such as spina bifida, where part of the neural tube doesn't develop or close properly, and anencephaly, where a defect in the neural tube causes an underdeveloped brain and skull, but not whether your baby has the issue or not. If you haven't already been tested to determine your baby's risk of chromosomal differences like Down syndrome, this test can tell you that as well. Here's your first to-do that's just for the baby. Find him a doctor. You might be surprised to learn that your baby doesn't necessarily need a pediatrician. He can also see a family doctor. If you have a primary care provider you love, consider asking her to take your baby on as a patient. Congratulations, you're going to be a great mom.